Thank you for staying with us. Health is an important part of everyone's life, and good health determines how productive a person can be, especially when they participate in daily activities. However, getting access to quality health care is a major factor to staying healthy. Health financing is a core function of health systems that can enable progress towards universal health coverage. It has evolved from personal payment at the time of service delivery to using health insurance. Government funding is also necessary for services that insurance plans avoid or are inefficient in reaching, including community-oriented services and groups such as infants, women. Now, how important is this to help Nigerians stay healthy in the face of economic crisis? Joining us via Zoom is Executive Director, Hazy Health Initiative, Rhoda Robinson. Rhoda, good morning. Thank you for joining us. Right, we cannot hear you. Perhaps you might need to unmute.
Good morning. How are you doing today?
Very well, thank you. It's good to see you again. Now, let's talk about this matter of accessibility, affordability of healthcare, and the quality of healthcare, especially when we're talking about financing. What is it like? What's the state of things from your perspective? We know you play in that field. What have you seen or noticed?
Thank you. I'll just say it's not a surprise, and it's not news that currently a lot of people are finding it very hard to get by. The economy has not been very friendly, especially to those who live very close and under the poverty line. And healthcare has increased lately. In the last couple of months, medication that you could have bought for a sum of amount is now like 3 or 4 times the current cost, making it more difficult for people to access and afford healthcare. And when you look at how this turns out in our general society, you'll find that the general quality of health has decreased. And when you look at it in the terms of looking at how women have access to healthcare services, you find that it has the potential of increasing our maternal and child mortality rates, which we have fought so hard to bring down over the last couple of years. Now, we are currently around 512 to 100,000 live births. Now, imagine if a lot of women cannot afford to go for ANC, cannot afford skilled birth attendants, or cannot afford to finish their postnatal care, how that would impact already existing positive impacts that we are having in health indicators, and how that will bring down what the gains that we've gotten so far. So it's very, very important that we start looking at how do we make sure that regardless of what the economy is looking like, people who need access to healthcare the most have that access, and it remains affordable, it remains accessible, and they are able to get it when they need to.
So how do we determine that the people that will need it the most? Because everyone that walks into the hospital will need medical care.
Yes, but how many people can actually walk into a hospital? Majority of the time, you'll find that in most rural communities or underserved communities, the access that they have are primary health facilities. Most of the times, these are understaffed. They do not have enough commodities or consumables to actually address the healthcare needs of the people. And a lot of times they have to refer to either tertiary institutions or secondary institutions for more care. These places themselves, they are overpacked. So what is the option that people have is to go for private care, which is very expensive. Now, everybody needs better healthcare. Everybody needs access to information to keep their health well. But majority of people do not have that information. The majority of people cannot use that information properly because everything is still tied to financing. When you go into a health facility, I live in the urban central. So when I have a health issue, I can easily walk into my healthcare provider's office and talk to him. I have a health insurance. I know that this is covered. Majority of the populace do not have this kind of opportunity. They don't have this kind of access to healthcare. So when you're looking at who needs access the most, you're looking at people who cannot afford access to healthcare, access to quality healthcare that they need to live better lives.
Perhaps we need to look at the matter of our health insurance system, because this is why this scheme was put in place. Out-of-pocket treatment in Nigeria have been very expensive for a majority of persons. Even those that can afford it still find it quite challenging. But thanks to the health insurance scheme that came in, the matter of the health insurance scheme getting to these kinds of persons, what do we have to do? What are the bottlenecks standing in the way? State governments, how have they adopted these measures such that it gets across to a majority of persons at no matter the locality, so that they can access quality health care?
I think the state governments have been doing exceptionally well in trying to ensure that more people have access to health insurance. We've had the opportunity to work with almost all the states in Southwest Nigeria who have been putting a lot of efforts in ensuring that health insurance reaches this population. But you find out that it is still not enough. We have more than 70% of health financing coming from out-of-pocket finance. Why is this? Why are people still spending money from their own pockets to pay for healthcare? And right now, healthcare is so expensive.
Right.
A lot of people would rather just stay and pray to God that it gets better than having to find financing or find funds to pay for these healthcare services. People cannot afford healthcare service. People cannot afford insurance. It might look little. I think right now it's around between 9 to 15,000 naira for the premium. But when you have someone who earns a profit or an income of less than 1,000 naira a day, and they have housing expenses, they have family expenses, they have education to deal with, they have the rising cost of food to deal with, you find out that thinking about paying health insurance of 15,000 naira is the farthest thing from their mind, and they just try as much as possible not to get sick. And then when they do get sick, because everybody at one point or the other, when you stress your body, you break down. And when they do get sick, they have to take it to their limited savings to try and offset the cost of medical attention or medical care that they need to, especially in poor families, especially in families that they have large number of children or large number of individuals within that family, and they do not have a lot of income. So when you're looking at payments or financing healthcare from the individual side, from the family side, you need to start thinking about how much liquid cash or funding does that person have. Right now, in the last EFINA survey report, they stated that one of the barriers to financial inclusion, especially for women, is that a lot of them have reduced income generation. So when people are having reduced income generation, it is obvious that they are going to start cutting costs at different areas. And the first place that people cut costs from is that education and healthcare. That's the first place that's the first thing that goes when you're trying to save money. Because the first thing you want to do is ensure that you have a roof over your head, and then you ensure that you have food to eat. So when you're looking at that, you need to start saying, what are the challenges that prevents people from actually signing up to health insurance? And this is where financial institutions come in. This is where private sector organizations come in. This is where health insurance themselves, especially those that work at the community level, that design packages for low-income earners, come in. We need to have that synergy that takes into account the realities of the people that they're designing this product for. You cannot say that you are designing a health insurance product for a person and your premium is 20,000 naira when this person does not make up to that amount in 6 months, because they have a lot of expenses, when these people don't have savings, when these people don't understand the benefits of having health insurance. So we need to have tailored packages that address the specific needs, that realize that if they could, people would pay for health insurance and start investing in it.
All right, so I'm reading something online, and it's saying that 70% of Nigerians still patronize herbal medicines, looking at the fact that it's as old as mankind, and many people say it as highly effective in treating some kinds of diseases. And so many use this and have the mindset that they don't need to go to the hospital because it's expensive, and this is quite cheap. I was as low as maybe 100 or 200 naira. You have a shot and you're okay. I would like you to speak to all of this.
Yes, I grew up in local community around Surulere in Ejesha. So herbal medicines, agbo, that's usually what it's called, is the most common form of medication. When you're sick, drink agbo. When you have malaria, drink agbo. Your body is failing you, drink agbo. Literally anything that is wrong with you, there is a herbal concoction that can solve that problem. The fact is that a lot of this do more harm than good. And most people, one, ignore this fact because they cannot afford healthcare services in hospitals. And they just believe that it's a science misinformation, that you're just trying to change what tradition has already put in place and has made cheaper and more available to them. So when you're looking at trying to get people to understand that healthcare is better, going to a clinic to get tested first, especially when you come to the case of pregnancy, women who are pregnant and women who are nursing, when you're trying to tell them that sometimes these concoctions, they harm their body and they harm their babies as well, you need to be able to provide an alternative for them, an affordable alternative, because you cannot tell them to leave agbo that costs 500 naira and would make them think or would treat their ailment and go to the hospital and pay 5,000 naira to see a doctor that they would have to wait for 5 hours before it gets to their turn and then come back and go through all the stress of having access and talking and explaining and then most likely not understanding what they need to do at the end of the day. So it's an interrelated issue that you need to address from the financing part, from the education part, from the access part.
Sorry to cut you, but do we have statistics to prove that these local herbs like agbo, as it's called, do more harm to our health than good?
There have been various research. There have been various research on its effects on the liver. There have been various effects on various research on its effect on blood pressure. There have been various research on the effects on the heart. If you look at scientific research, anyway, just search about it. You will see there have been studies done in the universities and in medical institutions that cover this array of information on the different types of medical of traditional concoctions and how it affects the body. So this information is not available out there. It's not simplified. And then you now need to tell people that this is what this does. But what is the alternative? You are telling them that they should not drink agbo and that they should take anti-malaria. Well, anti-malaria currently costs over 2,000 naira. Are you going to pay for it?
True.
When they have malaria, when their children have malaria, are you going to pay for that drug that you are telling them would solve the problem, but they should not? So when we are looking at challenging existing negative practices or behavior within society, we should also look at investing in what the proper solution is. How do we ensure that when we tell women that they need to go for ANC, that they have access to it and they can afford it? AC currently runs that kind of program where we provide malaria testing treatment for pregnant women and community people right where they are and then link them to the health facility. Because at the end of the day, we need to build that culture of them going to the facility to have proper care done. Because when you leave, there's a high chance that they just go back to where they were because it is not a sustained intervention. So you need to sustain it by working with the people themselves, changing their understanding, changing their mentality, and working with existing resources that you find in that community. Work with the healthcare workers, train them, talk to them, support them with commodities so that they're able to provide more for this community member at the most affordable rate, because not everybody can afford private care.
Right. So what strategies then can we then employ to address this matter of accessibility, affordability, especially in underserved areas where we have most of these women who do not have as much monies to pay for healthcare as it is? We know the situation with our primary healthcare as it is. About 80% of them across the country are said to not be functional. And then when you look at the structure of our healthcare system, it's also generating concerns. Structure on the one hand, accessibility on the other hand, affordability, another matter. How do we address them?
So I'll take it one after the other. First, we've been working with a couple of states, as I said, and they have been intense efforts to improve our healthcare facilities. If you look at Osun, if you look at Oyo State, if you look at Lagos State, there have been serious works and investments in upgrading these facilities, training healthcare workers, and increasing manpower availability within these facilities. And that is where partners also come in to support the government in doing all these things to improve the quality of care that is available in these facilities. Now, OHC is currently working with private organizations, private financial organizations, to develop a product that, one, addresses the issue of access to finance for women. The last guest that you had on the show, I talked about the high interest rates for lending that the CBN is giving to banks. And when you look at this and how this translates to people's ability to actually access credit, especially women's ability to access credit, which is currently below 20%. When you look at this and you say, how do we actually support women to be able to access credit, invest that credit, and be able to stop paying for healthcare services from out of pocket on what they have? You find that you need the partnership of both the financial institution and both the healthcare providers and insurance, health insurance institutions as well. And this is what we are doing with our partners. We are bringing together these key partners to, one, invest in women's financing. Right now, we're working on establishing a basket of over 100 million naira strictly for women's access, so that they are able to access loan. And when they are accessing this loan, as part of that program, they would also have access to health insurance as well. Because when you give people money, when you give women money, if there is a crisis within her family, the first thing she thinks about is solving it first. She forgets everything she had thought about when she was collecting that money. She forgets it all and she tries to solve that problem within her home. But when you have already addressed the issue of healthcare insurance for her, such that when she has insurance, because there is statistics that show that there's a very women who have health insurance visit or seek healthcare more than when they did not have it, because then they are not forced to take out from their own savings to pay for healthcare. So you're already increasing access to available healthcare services within them. So bringing these key partners together and working with them to design specific products. And I say this again because you find out a lot of solutions, when they are designed, they are not designed with the people in mind. They are not designed with the realities of those people in mind. You see that when they say we need more financial inclusion, the first thing that people do is that, okay, let's create a product that gives people access to loan. But can these people afford the interest rate on that loan? What is the modality about actually qualifying for the loan or the repayment of the loan? How do you see the realities of these women? How do you see the realities of local women in accessing this loan and then paying it back? Because your solution might just be another burden for them at the end of the day. So you need to speak with them, work with partners who already understand their realities, who have worked with them, who understand how the different intersections of their realities play in the decisions that they make. That way, when you are designing products, you know that you are addressing a specific need. And we can't take out the fact that private organizations are made for profit. But at the end, at the same time, when you look at sustainability, if you bleed your people dry, there will be no customer for you tomorrow. So making them understand that by investing in the people that are their customer, they are also increasing their own CSR, they're improving their image as well, and the possibility of sustained income in future.
Well, we'll have to leave the conversation here now, but we must thank you, Executive Director, Hazy Health Initiative, Rhoda Robinson, for your time on the program.
Thank you so much for having me.
And well done on what you're doing.
Thank you.
Right.